Good morning, everyone. My name is Dr. Sacoby Wilson. I'll be your keynote speaker. I'd like to welcome you to the last day of Taking Nature Black. Today, as part of my keynote speech, I'm going to talk about addressing environmental and climate injustice during the syndemic and the need for liberation and empowerment science. So let us get started. So we're doing this during a syndemic. What is a syndemic? A syndemic is basically multiple pandemics. We've been talking about the coronavirus pandemic, but we have other pandemics that we've been dealing with. And I want to talk about those pandemics during this presentation. So we have a pandemic of 400 years of racism in this country. You saw the supremacists, the white supremacists on January 6th, basically two Americans that we're talking about here. So what do I mean by 400 years of racism? We're talking about racism that's baked into the walls of America, right? Racism that's basically American as apple pie in this country. Why is racism so important in this discussion? When you think about climate change, you think about environmental justice, systemic and structural racism is part of this discussion. And why is the discussion of white supremacy so important? Because white supremacy is a big driver of the hate and structured violence that we have in this country. If you look at the 8 minutes and 32 seconds of George Floyd, right? If you look at Ahmaud Arbery, you look at Breonna Taylor, you look at Tamir Rice, you look at Michael Brown, you look at Trayvon Martin, right? You look at the recent examples of young women of color getting pepper sprayed, getting body slammed. That's, to me, white supremacy, the dehumanization of these folks. Remember the little kids who've been arrested, right? Little Black kids of color been arrested for temper tantrums in schools, right? So young that the handcuffs fall off their hands. Think about the police brutality, the over-policing in communities of color, the over-sentencing, the fact that you have people who are dying in the streets. That's why the Black Lives Matter movement was so important, because we're saying stop dehumanizing us. And that structured violence and that trauma is important to this discussion today. You know, I'm tired of seeing people who look like me murdered every day. That's traumatic, right? The families who lost their loved ones, that's traumatic. So part of what we have to think about is, how can we address white supremacy? How can we address racism? Think about the history of racial and biological exploitation of people of color in this country. That last administration was the biggest steal since the original steal of this country. Since the lands were stolen from our indigenous brothers and sisters, I need to make sure I give reference to the Piscataway people where I am right now in Maryland. And then also the stolen bodies of Africans that were used to build this country. You have to think about those issues, right? So white supremacy is something that we have to address. And that's real talk, y'all. And we're gonna make sure we take nature black. We wanna make sure we address the nature gap. We're gonna make sure we provide access to natural resources, right? To clean rivers and streams. We have to address white supremacy. We have to address racism. Racism is a public health issue. Racism is killing people. Racism leads to stress, right? People were dying from heart disease and strokes, elevated blood pressure because of racism. Then you think about coronavirus, right? You know, so we talk about racism as one of those pandemics. We talk about coronavirus as a pandemic, right? We know of the disparities in morbidity and mortality between people of color and whites, right? Black folks dying more, getting the coronavirus, been exposed to SARS-CoV-2 virus and getting coronavirus. Why is that? Coronavirus has made visible the populations our policies have made invisible. Meatpacking workers, healthcare workers, frontline workers, transit workers, right? I had a sister who's a nurse who got COVID-19, she survived. A niece who worked in a restaurant got COVID-19, she survived. But what about those 500,000 people who did not survive? What about our brothers and sisters who picked our food and then you have those hot spots of coronavirus? Folks working in meatpacking facilities. What about our indigenous brothers and sisters? We're saying, man, they need to make sure that they wash their hands. You know that we have people in this country who still don't have access to water, potable water, right? Think about those who live in colonials on the borders, right? The people in Central Valley of California, we have so many people in this country who do not have access to safe water. But then you think about, why do we have this disparity in the coronavirus, right? Well, we have to think about the economic apartheid pre-coronavirus. Reverend Lawson, when you eulogized John Lewis, talked about the plantation capitalism in this country that has and have-nots. Those essential workers are disproportionate folks of color, people who look like me, right? Folks who have to go out here and be exposed to the virus because of a system of capitalism which makes them less than. which again exploits them. Remember I said racial and biological exploitation. And then you think about why else, Dr. Wilson, are people getting sick with coronavirus? Well, you have to think about this healthcare part-time in this country. People don't have access to healthcare, right? Insurance. They may have access to poor quality healthcare, but at the same time, when they go to the doctor, they don't get good care. You saw the doctor, Dr. Moore, who was in the hospital with coronavirus, was getting poor care, and said her care was racist, and she unfortunately died. That's the experience of folks of color in this country when it comes to the healthcare system, right? Is the racism. Think about this. Black women in this country are dying 3 to 4 times more than white women during childbirth. One of the most sensitive times, one of the most vulnerable times when you bring a new life into this world. That's not due to income. That's not due to genetics. That's due to race and racism. So that's another pandemic. We have the pandemic of climate change. We know that the issues in the global north and the global south, right? What we do here, the ecological debt. But we also know when we think about climate change makes visible those populations also that are economically vulnerable and socially vulnerable. Climate change exacerbates and increases environmental injustice. 15th anniversary of Hurricane Katrina last year, right? You think about the heat waves in this country. You think about flood in this country. Think about what just happened in the Gulf Coast last year with the multiple storms, 7 named storms, the most named storms in the history of our naming of storms in this country, right? And then just recently, the storms in Texas, the winter storm in Texas, we had no idea this could happen. A state, ironically, that's the energy basket, right, of the country, but they didn't have the capacity, the ability, or they didn't want to protect their systems during these extreme weather events. And who was impacted? Of course, the whole state was impacted, but who was disproportionately impacted? Who's always, when you think about preparedness for storms, is going to be left out of the equation? Folks who are socially, economically vulnerable. Last year was also the 25th anniversary of the Chicago heat wave, right? So you think about heat islands. Why we have it? Because of segregation. Y'all know the history of redlining in this country. I don't have to go through that history. If you don't, please look it up. You know, you think about the history of racism again in this country, inequities of planning, zoning, and development. Baltimore was the first city in the country that actually had racism-based zoning. It got thrown out. Right, of the Supreme Court. But that racism is baked into our housing policies, our planning policies, our zoning policies. You know, you think about when you have redline neighborhoods, they're gonna be hotter. Why? Because they have more concrete and asphalt. A lot of these redline neighborhoods don't have municipal services. A lot of these redline neighborhoods don't have trees. Trees are good for what? Air pollution mitigation, heat mitigation, noise mitigation, right? Trees are good for food. Trees are good for playability. Trees are good for your mental health. A lot of these communities don't have, there is a nature gap, y'all. So you think about these specific policies of not providing people access to loans for housing and how that leads to neighborhoods over time that are hotter. You have temperature trends with climate change, right? That means heat waves, y'all, are hell for the poor and the elderly. We're gonna see more morbidity and mortality for folks who live in these places where they don't have, again, trees. They have too many impervious surfaces, right? And they don't have air conditioning. So you look at the city of Baltimore, for example, and what's happening there when it comes to impervious surfaces and when it comes to heat. You see the maps. Look at this study in Richmond, Virginia. There's been some great work done. Look at Baltimore Code Red report, great work done. Look at the work of Shonda's when it comes to heat islands and temperature and redlining. We know, again, these connections. Again, so the role of racism. Now you think about this other pandemic, right? This other pandemic is environmental pollution. Now I want to put my slides in slide view, but I'm worried that it'll get stuck again. So that's why it's not in slide view, y'all. But you think about Dr. King's work, right? You know, Dr. King is the grandfather of the environmental justice movement. I say W.B. Du Bois is the great grandfather of the environmental justice movement, right? But why is this important to talk about Dr. King? 53 years ago, he was assassinated right in Memphis, working with the sanitation workers, right? Talking about issues of labor and the exposures and how they were treated. You saw those men carrying around signs that said, "I am a man." Why is that important? They were saying, recognized by humanity. Go back to what I said before about Ahmaud Arbery, Breonna Taylor, you know, George Floyd, 8 minutes and 32 seconds. The young man who was taking subways home was a month ago now and got killed by a police officer. Why does this keep happening? People are shocked. Now we have video evidence. That's white supremacy. Yeah, that is structured violence. That is trauma. We're talking about intergenerational trauma from how these folks are getting treated by police states, how young girls have been treated, young girls of color have been treated. This is also part of that. When we give a permit for a facility to pollute, that is state-sanctioned violence too. That is a state-sanctioned form of poisoning, right? So we've been poisoning folks of color for generations, y'all. So you think about the work of Dr. King and the EJ movement, we're talking about fighting against that and fighting against coal-fired power plants, gas pipelines, right? Fight against incinerators, fighting against refineries, fighting against concrete facilities, right? Fighting against industrial chicken farms, fighting against industrial hog farms, fighting against highways, fighting against goods movement activities, right? Ports and the big truck traffic. Why is all that stuff always in communities of color? Dr. Bullock, who some call the father of the EJ movement, so you got the great-grandfather, you got the grandfather, you got the father, you got the Mother Johnson, Chicago. Just y'all know a quick fact, Mother Johnson, who was the one who trained President Obama up in community organizing. You can talk to Cheryl Johnson, the daughter, about that. But why? Why? Dr. Bullock talks about complexity for protection. So again, racism is important when we talk about this. You think about, how are we supposed to protect everyone from pollution when we don't enforce the laws? This first definition of environmental justice is the EPA's definition. Equal enforcement, regardless of race. I like to say, y'all, that's the all lives matter definition. When we talk about Black Lives Matter, it sounds better when you say Black Lives Matter, but Black Lives Matter too doesn't roll off your tongue well, right? It's the same thing here. We know that we're not enforcing all the rules and regulations of these communities of color. If we did, we would have no environmental injustice. If we just enforced and comply with Title VI, we wouldn't have any environmental injustice. If it just had complied with the lead and copper rule in Flint, Michigan of the Safe Drinking Water Act, we wouldn't have that Flint water crisis. Thank God they indicted the governor. Thank God they indicted the health department folks. Thank God they indicted the people in Region 5 of the EPA. Because what they did, they dropped the ball. They did not see humanity of the folks in Flint when it came to decisions around the water access, right? Switching the water supply. And think about now with those kids in Flint, what's happening. Think about the people who died from Legionella, right? But the lead issue, I'm gonna say something to y'all. How are we gonna put America first if we don't put our kids first? We got too many kids of color in this country that are living in toxic environments. Instead of having the next Obama, the next little LeBron James, right? You're putting a cap on the potential. Lead is a neurocognitive intoxicant. There's no safe level of lead, y'all, okay? The second definition that you see is Bunyan Brown's definition. How can we realize our full potential, remember I said potential, capital potential, without experiencing the isms? Environmental justice is about decent paying jobs, y'all, schools, recreation, okay? That social determinants of health. You're talking about housing, okay? So he's talking about, instead of unjust housing, just housing. Instead of unjust food systems, just food systems, right? Instead of unjust jobs, just jobs. Instead of unjust school, just schools, right? Instead of unjust decision-making process, just decision-making processes. Environmental justice is about what we live, we work, what we play, what we pray, what we learn. Environmental justice is proximal, it's everyday, it's pocketbook. It's your neighborhoods around you, it's what's around you. The biologic features, right? The living and abiotic features. It's about your rivers and streams, but it's also about your dreams, right? It's about the opportunity structures, right? It's about human rights to clean air and clean water. It's about food sovereignty and energy sovereignty. It's about empowerment. So you think about these communities that are overburdened by hazards. Those locally wanted lands we're talking about, incinerators, chemical plants, factories, pollution-intensive operations. Then you think about some of these same communities are overburdened by psychosocial stressors, right? Poverty, racism. And then these same communities may not have access to amenities, okay? May not have access to amenities. So built amenities, social amenities, ecological amenities. For example, not having enough access to green space, not having access to supermarkets and grocery stores. And that's not by accident, that's by design. Not having access to sewer and water infrastructure, not having access to Wi-Fi. Think about what this coronavirus pandemic has shown us. Yes, we had a school divide, It's also shown us and made worse the Wi-Fi divide too, right? The digital divide is really important. So you think about these pandemics we're talking about. You got pandemic of racism, white supremacy. You got the pandemic of toxic plantation capitalism. You got the pandemic of climate change. You got the pandemic of environmental pollution. You got the pandemic of the coronavirus. So you think about communities that impact these issues, the disparities that they're dealing with, right? And race is important in this discussion. Whites have a pollution advantage. Folks of color have a pollution disadvantage. We're talking about a syndemic, everyone. So you're going back to coronavirus. Another reason why folks of color have differential morbidity and mortality is because of air pollution, right? Because you have all these highways and byways going through people's communities. What does that do? Think about the reduced lung capacity, the damage to people's hearts, the damage to people's alveoli from pollution. So when coronavirus comes in, when SARS-CoV-2 comes in, of course, you're gonna have more morbidity and mortality, right? Highways and byways bisecting communities of color. Remember the National Highway Defense Act, right? Urban renewal. And think about particulate matter as a very egregious aspect of this when we combust fossil fuels. So we think about dealing with climate change and reducing greenhouse gases, we got to get rid of co-pollutants by particulate matter. We got to transition to renewables because of what air pollution is doing to these communities. It's not just environmental injustice. It's not just environmental racism. It's environmental slavery we're talking about here. We're using communities to host locally wanted land uses. They get the burdens and get the deficits. They internalize the pollution, right? The externalities, both the environmental externalities, the health externalities, the social externalities, right? The economic externalities, and get no benefits from it. Somebody else benefits from it. That's environmental slavery. That's environmental oppression. So you think about particulate matter. Why is it so bad in this discussion? It causes asthma attacks, elevates your blood pressure, right? It contributes to diabetes, strokes, heart disease. It contributes to also Alzheimer's. It increases birth defects, infant mortality, low birth weight births, cancer, leads to mortality issues, right? And decreased life expectancy. But PM, there's no safe level lead, there's no safe level PM. Did y'all know that last week it was reported that Black folks just lost 2.7 years of life expectancy? Think about why is that? Coronavirus, yes. We just have 4 years of a white supremacist in chief in office, 4 years of anti-health policies, 4 years of anti-climate policies, 4 years of anti-humanity policies. That administration was an administration that was all about xenophobia, putting young kids of color, immigrant kids, children, Latinx kids in cages, y'all. Rolling back environmental regulations that we need, that barely are working to protect communities of color. Economic policies that didn't benefit everyone. That's why folks lost so many years of life. We need those days back. We need those months back. We need those years back. How can we get those things back? What can we all do to make that happen? So one of the things I like to say is I believe liberation and empowerment science is part of that. Why is science a part of that? Well, I would say science is part of it because remember I said the racial and biological exploitation of people? Let's go back to coronavirus. Why so many people skittish about the vaccine? Some is because of what I said before. It's not just about Tuskegee, y'all. It's just not because of Henrietta Lacks, y'all. It's just because Black women being sterilized, right? You got this eugenic strain in the medical system, right? It's just not because the father of gynecology did his work on enslaved women of color, right? Enslaved Africans. You have it time and time again, Western science, US, has let folks of color down because we've been exploited during the scientific enterprise. We've been exploited. So we have to have science that's less about extraction and science that's more about action. We have to have more science that's less about what's wrong with you and science that's more about what's right with you. We need science to be for the people and do science that serves. We are all using science and technology right now on this Zoom call, right? We eat science, we wear science, we drive science, we watch science, right? We breathe science. Some of that science is bad science. We wear science, right? So what can we do to make science, again, more proximal. We have to make science pocketbook. We have to make science every day. We need more scientists of color. We need more scientists who come from these communities with frontline, first-line communities doing the work. Science is important, part of this discussion, because science is part of the reason why we are what we are. So just in the same way, zoning and planning should be part of the solution because they've been part of the problem. Science can also be part of the solution when it's been part of the problem. We have to do science as more, community-based science, science within relationships with frontline, frontline communities. We have to make sure we have science that's community-driven. Community members are the contextual experts. They're the ones they're in these communities every day. So they have to be uplifted. Community cultural analysis need to be uplifted when we're doing projects, and then make sure that data is translated to action. It's just not good enough to study stuff, y'all. I mean, think about this. You are a scientist. You got communities doing all these pollution issues I just outlined. It's multiple pollutants, y'all. It's multiple stressors, multiple health effects. And you just on the sideline just studying stuff. Observation, doing inquiry. That's extractive. I call that pain pimping science. You overstudying people's pain, but you're not doing anything about the pain. I'm sorry, I come from a community with a landfill in a sewage treatment plant and a concrete plant. My dad was a pipe fitter working at some of these pollution facilities, right? I don't have a choice to do science where I can just be on the sideline. I can be dispassionate as opposed to objective. There's no objective science. Because we all have our lived experiences, our lenses, our biases that drive the science that we do. I want to make sure that we do very objective science because the objective is to solve the problem. If you're not doing science to solve the problem, then we don't need your science. If you're not doing science that's disrupting this system of environmental slavery, environmental racism, structural violence, and trauma that communities of color are suffering, we don't need that science. We need, again, liberation science to free us from environmental slavery. We need empowerment science so communities are doing the science themselves. Science has to be other people, for the people, and by the people, right? And I'm getting low on time. I'm probably gonna spend another 3 or 4 minutes. I'm gonna close out and take a couple questions so we can make sure this program says on time today. Transits at 10:30. But some of the science that I do something called community-based participatory research, where the community members develop the questions themselves, right? They help design and study. It's co-creation, right, with the researcher. Study design, data collect the data, right? Boy's 5 dimensions of science is a really important part of the discussion. It's part of the science philosophy I've been talking about. You got scientists that just do discovery science, but you have inquiry. Beyond inquiry, you also have teaching, you have integration, you have engagement, you have application. To me, if you're not doing all 5 dimensions of science, you're doing incomplete science. Again, we need to stop funding pain pimping science. We need science in this field that we can understand and document exposures and impacts on our ecological resource like in the Chesapeake Bay, but then we use that data for action. We use that data for empowerment. We should be doing science. Did you improve water quality? Did you improve air quality? Did you improve access to parks and green space? Did you increase the tree canopy? Did you reduce the urban heat island? Did you reduce stormwater, right? Did you make people more prepared, right? So do you have equity preparedness, equity response, equity recovery? Are people able to come back home after a disaster? Whether it be Katrina, whether it be what the disaster in Texas, whether it be Hurricane Michael, Hurricane Maria, right? Hurricane Sandy, Hurricane Florence, Hurricane Harvey. Can people come back home? We need to make sure we're not having disaster capitalism that leads to climate gentrification. We have to make sure when we do redevelopment, it's not leading to green gentrification. Why do people fight for change and improving the environment? They get pushed out. So suburbanization movement disproportionately impact and benefit some groups. And gentrification is expulsive zoning development planning is doing the same thing. Science has a role to help with that, to assist with that, right? And then we think about these issues we're talking about. You're gonna work with communities as scientists and using science, collecting data. What are the issues, the impacts, the opportunities, the benefits, and the partnerships? How can we work together? So the idea is we should be focusing on things that are everyday, proximal, and pocketbook. So food, faith, family, health, and jobs. So as a scientist or the use of science, those things are important, okay? And citizen science is a type of science where we can democratize access to scientific tools and information and data, right? So the idea is science is not an end, science is a means to an end. So what are the tools that you can develop and get to the people so they can collect their own data? Again, on air quality, on their rivers and streams, right? On restoration projects, okay? On their tree canopy, on the type of species of trees that are in the community that are healthy, on the amount of community parks and urban agriculture they have, right? There's so many tools out there, but as a scientist and the act of science, we gotta get the tools into the hands of the people. And in my work, we do a lot of that, developing geospatial tools, developing mapping tools. Now, I have way too many slides, so I'm gonna close out in a minute. But the last thing I wanna say is, we got to make sure science is about empowerment. And y'all see on the slide, like empowerment is spelled incorrectly. That's not, no. We cannot give people power. The idea is about empowerment. How can we help people connect to the power they already have? How can we help people build their power? How can we help people actualize their power? How can we help people use their power, right? How can we help people collect to their collective efficacy, right? And increase their capacity and their agency. So not giving someone power, but providing the opportunity and space for people to build power. If we're gonna address these issues that we're talking about, we're gonna address environmental justice, environmental racism, environmental slavery, right? We're gonna address environmental oppression. If we're gonna attack this syndemic, we gotta have liberation and empowerment science. Not just extractive science, not just helicopter science, not just paint paper science, not just, oh, Dr. Wilson, I gotta get tea and promotion science. We gotta do science. It's not about changing your pocket. We gotta be doing science about change for the people, okay? That's important. So I just wanna close on the fact that if we're gonna move forward with addressing climate injustice, we're gonna move forward with addressing environmental injustice, we're gonna need to do better when it comes to empowering folks. We're gonna need to do better to make sure that the people who are on the front line, the fence line, are driving the work that we do. We're gonna have to make sure that if we're gonna bend that, that arc bending towards justice, we have to make sure that the science that's been done is no longer done on us, it's done for us. It has to be about FUBU, for us, by us. It has to be of the community, for the community, and by the community. That's how we get liberation from environmental degradation and environmental slavery. Thank you.
Dr. Wilson, would you like to take a question?
Yeah, yes, sure. I'll take one question or two questions before the 10:30, so make sure we stay on time.
That's fine. Here's a question. Describe a community in Maryland where your ideas are empowering people, help them use and build, address environmental health issues.
Yeah, no, thank you for that. So we're doing work right now in Cheverly, Maryland, to build a hyperlocal air quality monitoring network to address some of the issues around a metal recycler and also traffic pollution. We've also done work in Curtis Bay, South Baltimore with Free Your Voice. Started doing work with 2012 with Free Your Voice, Maryland Environmental Health Network, and EIP, providing technical support to those communities when it came to fighting the Energy Answers incinerator in Curtis Bay. Helped some assistance with folks in Bladensburg around the fight against the concrete block plant that wanted to expand to a concrete batch facility. So helped doing air quality monitoring and provided testimony for that. Also did a little bit of work in Brandywine related to the coal ash landfill in Brandywine, providing testimony in regards to that operation. In addition, we are developing geospatial tools to map environmental justice in the state of Maryland. So we have a Maryland EJ screen tool. We also have a park equity mapper tool. And in addition to that, we have a climate equity and health mapper tool. And then just to close, we're also working with folks in the Eastern Shore to look at issues around the impacts from industrial chicken farms.
Good, thank you. Here's a question that several people are interested in hearing an answer to. I'd love to explore more about Dr. Du Bois as grandfather of environmental movements. Could you point to some resources?
You mean Ernest Boyer's 5 Dimensions of Science? Is that the question?
It came from one of your slides earlier.
Bullard. Oh, you said Dr. Bullard. Oh, yes. So Dr. Bullard is at Texas Southern University. He is one of the esteemed, researchers, one of the EJ icons of Mount Rushmore environmental justice. So yeah, Dr. Bullard would be great. He actually has a Gulf Coast Health Equity Consortium working with Dr. Beverly Wright. So they're doing a lot of work in Houston, Louisiana, New Orleans, also Biloxi, Mississippi, and In addition, they're doing work in Tallahassee, Florida, and Mobile, Alabama. And Dr. Bullard has about 20 to 25 books. So all you have to do is go on to like Google, and you can Google his book. He says that every book is actually a chapter of the same book, but he has a lot of books that you can look up.
Thank you very much.
Thank you everyone who was able to attend the session. I appreciate your time. Sorry we couldn't get to more questions, but you can always email me. I'll put my email in the chat if you have additional questions.